health centers are a key piece of driving access, equity, and taking care of the patients and our community.
A dedication to the Kansas City community that started back in 1971 by a group of hippie doctors in a small house in Westport. It had a couple of name iterations over the years, including Westport Free Health Clinic. Then it was KC Free. Will Franklin is the CEO of KC Care Health Center.
We basically formed out of necessity to treat a community that was facing stigma, a community that was facing significant healthcare challenges. And we find ourselves coming full circle in 2021 as we turn 50 years old.
Today, KC Care serves 20,000 patients in 4 locations.
A full set of integrated healthcare services around primary care, HIV care, dental, behavioral health, full pharmacy that serves our patient population, and a multitude of other wraparound services connected to case management, community health workers, and those outreach services that really prevent chronic illness from spreading in our community.
Will knows the importance of what this service means to a population that's misunderstood.
Throughout KC Care's history, we've served patient populations who struggled to get insurance or access health care. A lot of people sometimes make the assumption that folks can't access care for various reasons that's somehow their own fault. But the reality is that's just not true. That's a myth. The majority of our patient population actually has multiple jobs. They are your bartenders, people who work in restaurants, fast food, the service industry.
What's unique about KC Care is how the clinic can turn patients into team members.
A lot of the people that we're serving as patients end up becoming employees of the organization at some point. So you can walk down the hallway and find people whose lives have been significantly impacted by some type of service that we provided. So there's a boomerang effect that tends to happen that we actually relish and look forward to, because that tells us that we're doing something right. Because a key piece of our success is taking care of the people who work here, because we think that we can't do a good job in terms of creating a great patient experience if we don't do a good job creating experience for our workforce as well.
The staff spends time not just at each location, but also going out into the communities KC Care serves, which turned out to be a life-saving strategy in the last few months.
Because we do quite a bit of clinical research here at KC Care, and we work with a lot of the drug companies and universities in doing clinical trials, we were one of the first community health centers selected to do COVID-19 clinical trial work here. Because we had the refrigeration technology, we're also one of the first organizations to get the vaccine in place. And so we doubled and tripled our efforts to get folks vaccinated.
To date, KC Care can be proud. 50% of the patient population is now fully vaccinated.
So we started going out and doing micro events, going to public housing, apartment complex, reaching out to neighborhoods, other organizations to really engage people where maybe misinformation was thriving or there was hesitancy about vaccines, trying to educate folks and really get us to a place where we can develop enough herd immunity to keep our community safe.
It is my honor and privilege to present tonight's second Hero Award to Will Franklin and the entire team here at KC Care Health Center. We thank you for your work in the community and recognize your work in the LGBTQ community as well as the community at large. Thank you so much for your work.
Thank you, and thank you for your efforts and advocacy. Appreciate it. Thank you.